First of all, let me introduce myself. I am Professor Arif Herekar. I'm basically a professor of neurology, and I've been into teaching the subject of adult and child neurology for almost like 4 decades. Most of it was in Dow, and the rest of it was at the Buckeye Medical University. Let's get to the point. Today's session is basically on something that has been disturbing me, and this is autism spectrum disorder. I've seen it grow, and I see many more patients today than I did ever before, in spite of being in a teaching hospital at Dow Medical College. Now, there are a lot of questions that mothers and parents would like to ask about autism. Where does it start? What age does it start? Is it congenital? Well, I think it is always from birth. Because now, if you look at the MRIs of children with autism, there are certain changes which are very specific to autism. And so it is there when the child was born. It tends to manifest, of course, at a later age, an year and a half at the earliest. But for the mother and the parent to detect it, it might take 2 to 4 years. So the commonest child age that comes to me is about 3 to 4 years. Of course, children who have been in the treatments already with therapies come to me late. It is also genetic. Of course, in the United States, there has been larger studies which show that almost 1 out of 68 to 70 children have some sort of autistic disorder. Now, autism is a disorder or a spectrum of disorders. It is what we call ASD, autism spectrum disorder. It has a lot of small disorders in it, like ADHD, which is a hyperactive disorder, or where the child does have attention to the surrounding, but if the child is totally non-attentive to the surroundings, we call it attention deficit hyperactive disorder, ADHD. Now, most of these children are hyperactive. Some have mild hyperactivity, some have absolutely uncontrollable hyperactivity, which is the most disturbing part of autism. Most of the mothers and parents come to me with children who have already been very, very uncomfortable, very, very restless, very, very fidgety, and have made the parents' life miserable. It is never easy to treat a child with ADHD or with AD or with other spectrum disorders, which include speech. But we have developed certain supplements over the last many decades which show fairly good results. If you ask me, do therapies work? Of course, I'm sure they have an important role to play, both speech therapy and behavioral therapy. Because the major disorder is that of behavior. It is not really of intelligence. A mother who brings in a hyperactive child who's running all over the clinic room or clinical cubicle is made to sit. A mobile is held in her hand, and he focuses on that, and he's quietened. Coming to this in the same context, I have realized, and I have been wondering why the spectrum disorder of autism has been on the increase. The proportion of patients coming in are much, much more with spectrum disorders. I, of course, deal with all sorts of mental speech retardations, but of late I have had a huge chunk of patients come in with hyperactive disorder or autism. I think if you ask me, the role of screen time or making the child dependent on mobile screens or larger screens has a very, very important impact. In the same context, people ask me, do we still continue with the screen? Well, a normal child can use the screen for an hour or two and will remain normal. But if you think the child is already withdrawn or has some signs of autism, I think the screen time will make the disorder, the manifestations, the symptoms worse. I would advocate and I would request parents to come to me with children who are restless and fidgety and unruly to see that they are paid more attention to. You see, the parents, now this is another important thing that I remembered, that I've seen more spectrum disorders in working women and parents who do not give too much attention to children. And then, of course, every house has difficulty in financing its daily routines. So now the trend is more than ever before of both the parents working, but we had that before as well. So I think the lack of parent attention and screen time both have compounded the issue, and that is why I feel strongly see more patients with autism today than I had ever before. Well, there's a lot to talk about autism. This little session may be getting too prolonged, but I'm practicing at the Hilal-e-Amr, what we call Teen Talwar at Clifton. And if you need to contact me, my numbers are 0300 2245945, 0323 0008018. This is my front desk. You can get my appointments. But I personally feel that if you feel at any age that the child is not behaving properly, he is inattentive, he is not focusing on the parents, bring him in. Because the earlier the therapy is instituted, the better is the outcome. Thank you very much.